Hi, my name is Chelsea Sartor. I'm a UT Dallas Comet alum, and I'm a PA student currently at UT Southwestern Medical Center.
Hello, Chelsea. Thank you for joining us today.
Hey, Dave, how are you?
I'm great. Thank you for asking. Let's talk about the situation we're in right now. What is your role as a PA student, and where are you located?
Okay, so my role as a PA student, I am currently in my last year, so we're on clinicals. So about once a month, we move from a new hospital or a new doctor's office or a new clinic. And we pretty much, at the majority of places, we'll go see patients, we'll present them to the doctors or PAs or nurse practitioners we're working with, and then they'll either agree with our plan, disagree, and kind of like lead us through our clinical knowledge.
Would you feel comfortable sharing with us an experience that you've had dealing with a coronavirus patient and some of the experiences you've gone through that may surprise some of the viewers?
Yeah, sure. So as a student, they do try and limit us to who we see with corona, but with the current times, it's almost impossible to be in a hospital and not come into contact with corona. I will say one of the biggest shocks that I've seen is that it's not necessarily the elderly that are coming in with the sickest symptoms like you would see with the flu. Usually the flu, the elder patients get the most sick, but corona, it's hit or miss. So in my clinical background, if you see someone come in and they have the droopy eyes and the body aches and the high fever, you can almost look at them and say, sometimes you can say, oh, you have the flu. You don't even need to test them. They just have a look about them that screams you have the flu. With COVID, there's absolutely no saying. The hardest thing is not knowing what to look for and identify for, not having that scientific research behind judging who to test and if it'll be negative or not.
As a student athlete, you played softball for 4 years at UT Dallas and were a part of a team. Right now, you're in a different kind of team. Mm-hmm. What did that experience as a student athlete bring with you to this experience, and how do you use those skills you've learned as a student athlete today?
I think one of the biggest things I've noticed is that a lot of our teachers, whether it be doctors, PAs, nurse practitioners, they give you constructive criticism. And as a student athlete or a past student athlete, you have been taught how to take that constructive criticism, that it's not someone being mean, they're just trying to make you better. And sometimes the best way to do that is by being direct. And I think some of the other students I've noticed, it might come across as a different way to them, somebody who hasn't had that constructive criticism like sports gives you. So I think that has been valuable, just to know how to take correction and learn from your mistakes. And there's other valuable things, of course, like working as a team. Like in medicine, you have to talk to their primary doctor. You have to consult other doctors in the hospital. You have to talk to your nurses. You have to talk to your physical therapist, your respiratory therapist. There's so many different people you have to communicate with. So, that played a vital role